anything positive we get.
Genetic testing. Genetic or DNA testing allows the genetic diagnosis of diseases and medical conditions, establishes the likelihood of developing inherited diseases, and can also be used to determine a person's parentage, ancestry, or a biological relationship between individuals. Genetic testing can use biochemical tests for the possible presence of genetic diseases or mutant forms of genes associated with increased risk of developing genetic disorders. Genetic testing identifies changes in chromosomes, genes, or proteins. The results of a genetic test can confirm or rule out a suspected genetic condition or help determine a person's chance of developing or passing on a genetic disorder. Several hundred genetic tests are used at present, and more are being developed. Today, we are going to demonstrate one aspect of genetic testing called genetic counseling. Genetic counseling is a process where individuals at risk of a genetic disorder are advised about the nature of the disorder, the results of having the disorder, and the probability of transmitting it to their offspring. Genetic counseling can occur before conception through to adulthood. A pregnant woman can receive counseling if screening shows chromosomal abnormalities or birth defects. The woman or couple can then decide whether or not to continue with the pregnancy or to prepare for the birth of a child with medical problems. Counseling can also occur after the birth of a child with a genetic condition to advise on risks for future children and to state the options that are available. Today, our genetic counselor will be carrying out 3 sessions to offer her expert advice. The first session is with a young married couple. Meet Mr. and Mrs. Sookdale. They have been married for 2 years and are interested in having a baby. They have undergone genetic screening and found out that Mrs. Sookdale has a mitochondrial disease. The counselor will now advise them about their options.
Hi, good day. Welcome back, Mr. and Mrs. Sookdale. As you were here previously, we did a genetic screening on your blood to see both of you, to see if you can have a child. Your sperm count is pretty good, and your egg is really good too. But what is the problem? We have detected that you have mitochondrial disease. Have you been lethargic, weak, exhausted lately?
At times.
Yeah, that's mitochondrial disease. It's strange you didn't bring it up to your husband or anyone at all, but it's fine. Mitochondrial disease is basically when your mitochondria, which is the powerhouse of the cells, is not working as it should be, and if not treated or left unchecked, you can develop, it could lead to damage of the cell itself, which can damage tissues and then organs, which is never good. We can talk about your treatment for mitochondrial disease afterwards, but in terms of having a baby, it wouldn't be optimum for your mitochondria to be transferred to the baby, because what happens, a baby's mitochondria comes about 94% of the mitochondria comes from the mother, and if you have mitochondrial disease, the baby will have mitochondrial disease. But there is a solution. Of course, I have to ask, you want the baby to have both your genetic makeup, right?
Yeah.
That seems legit. What we would do, we would have a donor, and we'd take a donor's egg and take out the nucleus from that donor's egg. We would then take one of your eggs out, take the nucleus from your egg, implant it into the donor egg, and then we'll take your sperm and then fertilize this egg, and that will give you your baby without the mitochondrial disease. We could do it that way, or we could fertilize your egg before we implant the nucleus into the donor's egg, so whichever procedure, but one is more cost effective than the next if you're looking at in terms of that. But there are solutions. Yes?
Looking at the safety wise, would be any risk to her?
No, we do this procedure very often. It's no risk. But I do have to tell you about the possible ethical issues that we have had arising. In Britain, we've had the possibility of 3 DNAs, so 3 genetic makeup in that child. But it's a touchy issue right now, but the child would be essentially yours, 2 of you, and we do have confidentiality agreements that the donor would sign. So it wouldn't be a matter of that, but it is my job to inform you about the possible ethical issues, but that child would have both your genetic makeup. Are you okay with that?
Yeah.
Okay, well, that will be all time here for the genetic testing. We've screened and you can have a healthy baby. Go on and go make babies. Come here at our clinic though. Okay.
Thank you.
Yeah, no problem.
This is Mr. Double D. He is single and wants to have a child because he feels that he is financially and emotionally ready. He has brought along his own surrogate, Shaniqua, to the counselor's office. Mr. D is diabetic, however, Shaniqua has no known medical issues.
Welcome back, Mr. Double D. Is that really your name?
That's my mother gave me.
No, Joe. Hold on. I'll call you back. Money here later.
Okay, I am sorry. That's a bit rude. Okay, so the screening for what we tested last week, the results are in, and I have some news for you. It's just news. I would say good or bad. Well, it is sort of bad. You have diabetes. Did you know that? You knew that?
Yeah, I was diagnosed.
Well, you didn't mention that.
No, I didn't mention it. I was afraid actually of the.
He have what? Excuse? He have what?
I didn't say HIV, I said diabetes.
I can't get that though. Don't say you're giving me no diabetes because your money ain't covering that.
It is hereditary though. It is hereditary.
You don't worry. You'll be safe.
Let me just, you guys can sort that out after. It's $500.
Your price just went up.
A minute. $500 a minute.
We have the money, darling. Don't worry.
Alright, so yes, you do have diabetes. You know what diabetes is. It's basically the islets of Langerhans. No, the beta cells. I'm sorry, I got it off today. Yes, the beta cells produce the insulin, and insulin basically controls blood glucose levels, and your beta cells are no longer functioning as they should be, and they are not producing the insulin to regulate your blood sugar, which is fine. You know that you have diabetes, but what happens is there is a possibility. Diabetes is hereditary, and it could be passed on to your child, and I know you want to have a baby, so I have to tell you that there is a risk that your child could have diabetes. There are certain precautions that you could take, certain lifestyle methods that is possible for you when you're raising your child to prevent them from getting diabetes, obtaining it, but there will always be a risk. But like I say, lifestyle and diet choices and basic well-being, and you should be able to avoid that.
So is it very likely or?
It's according to your screening, there is a I think it was 35% chance that you would pass though.
Question, my body good enough. So tell me, this baby that he paying me to have, I don't have to take care of a sick child. I'm not going to get that done.
No, it's not.
And this child can walk and talk. I will have any problems with this child.
Well, you wouldn't really be concerned with it after.
Yeah, because don't worry, baby girl.
Yes, don't harm this child for me.
Everything will be okay.
I hope so.
We have confidentiality. We have agreements for that, so you can comment.
Bring the paper, let me sign it. Your fee just went up. Your fee just went up.
Okay.
That's the problem.
You're on your sick body.
Talk about
That's
this after. Anyways, I do have to tell you about risk. You will not get diabetes from him, and the process is you're not going to be sleeping together at all. After we'll be taking his sperm, your egg, and we're going to be fertilizing all of that, and then we'll implant it back into you. But I do have to tell you that there is a possibility that you could get gestational diabetes, which is diabetes pregnant women tend to get later on in the pregnancy. It is possible, but if you abide to certain diet restrictions, like taking care of a child, you abide by those certain diet
Once I
restrictions.
get my money, I don't mind.
Okay, that's good. It's,
I'm not keeping the baby. I'm not keeping the baby.
do you know we have our own surrogates if
Guys,
you
where's
get
surrogates?
tired of your
No, darling,
known.
sorry.
Had I known.
He already booked me. Sorry.
Had I known.
Hush, you already booked me.
Well,
Go ahead.
Okay,
Go ahead.
basically that's it. Your screenshot of that, it is 35% chance. We could work with you and see how much we could reduce that. There is methods we can do to avoid that specific allele getting through. And say passing on to baby, we can work on that, but we a higher fee because it will be a more intensive study because we have to be taking alleles apart in this genetic procedure. But it can be done. Yeah, basically we can do that for you. So your risk could go down to below 10%, probably 5% depending on how much you have. We try to help you. Awesome. So we'll make an appointment for next week. We'll talk about that. Okay? Well, that's it.
Nice meeting you again.
We now have a long-time lesbian couple, Bonnie and Sam. They have been together for 6 years and are interested in having a child. One of them is going to carry the baby and they are seeking a sperm donor. They are here for screening and counseling from the genetic counselor.
Good day again, ladies. I can see your results are back here from your test we did last month or two was. Okay, so you guys want to have a baby, right? I'm seeing here.
Blue eyes.
Huh? Yeah, I'm seeing here.
I'm really good looking.
Blue eyes.
We really don't like ugly babies. No, that's not bad.
Oh, come on. You don't call a baby ugly.
I mean, sorry, not so cute babies.
Not so cute.
Yeah.
Okay, so I'm seeing here you prefer blue eyes.
Yes.
You want a tallish,
Like my height
You know,
is
type?
5.
okay, brown hair.
And we wanted to have like a facial features. Yeah.
Anything else you guys prefer in terms of the characteristic?
I don't know, we was thinking what sex would we have darling?
Female.
Yeah.
Prefer
like
girl.
females, yeah.
Okay. In terms of the okay. All these preferences, they are quite possible once we do our studies and our appropriate genetic engineering. Okay.
I would be carrying a baby, just so you know which one of us carrying.
Okay, you'll be
Yeah,
carrying,
yeah, I'll be carrying a baby. So we need a sperm to. I don't want no physical contact with any guy. I just
Well-
want his sperm to fertilize my egg.
Considering
No
that,
guys, okay?
No guys. I have my girl right here.
I get it. No guys, I get it. No guys. So considering that, I'm not seeing here. Are you suffering from any conditions such as diabetes?
That's why you screamed us.
I'm not seeing that here.
Well, I guess I don't have it.
Okay, guess you're clean. Okay. So basically, just to implant this
Baby,
fertilized egg in your womb with the carrot finance.
I would say so.
Are you emotionally ready for this?
What?
Are you emotionally ready for this?
I don't know, but I definitely want a baby.
Okay, so it's on. So next week
I
around
want one.
this time, check in here, get the procedure started.
Awesome, cool.
It was nice seeing you guys again. I'm hoping for a shake hand, but that's okay.
These are just a few of the issues that genetic counselors are faced with when dealing with genetic conditions. They play an important role in reducing the pain and suffering that may be brought about by genetic disorders.